All right, we're going to switch gears and talk about some local healthcare news. The National Institute of Health has awarded the Iowa Primary Care Association more than $500,000. That money will be used over the next year to train an AI model. But what are they training it for, and what's the goal? For those answers, we sat down this morning with Kyle Breeze, Chief Financial and Analytics Officer for the Iowa Primary Care Association.
All right, Kyle, thank you so much for your time today. Over $500,000, that seems like a lot of money for this program. Were you expecting this amount of money?
Yeah, we were expecting this amount of money. I think it's that combination of our partnership collaboration here locally, focused on serving over 250,000 Iowans that are medically underserved, often with a disproportionate need as far as co-occurring and complex conditions. Over 90% of patients that are seen at our health centers here in Iowa, they are below the 200% federal poverty limit.
All right, so walk us through how this is going to work. You're going to be training this AI model over the next year or two. People are getting more used to AI and what it sounds like, but a lot of us are only familiar with things like Claude or ChatGPT. What does it mean when we're talking about training an AI model?
Yeah, so through this process, of course, we first and foremost prioritize patient and data security, data safety. And so we've built patient privacy as our prioritization, and all of our data being used is de-identified. If you think about training an AI model, it's something like giving this model, this system, as you referred to a couple examples there, but the opportunity to look at data, and then we as humans are kind of telling it how to think about the data, how to perceive it, give it some vocabulary or definition. Sometimes even you can think about it in a flashcard sense. When you're teaching a child what is an elephant, here's a picture of an elephant, here's a picture of giraffe, that's not an elephant. And so it's bringing those insights together to then say, when we look at this complex population, when we look for those patterns, what is that opportunity to give greater insight for our community healthcare providers so that when they are potentially, and right now we're just in that point of developing the model, looking at the data, but that they are empowered with greater insights than they might have today when they're looking at that patient.
I don't want to oversimplify this, but I do want to, nuts and bolts. Is this AI is looking at this data, it's looking for patterns at what, patients who maybe have predispositions for this. There's a pattern here. They maybe all have this type of symptom or this disease maybe that they've all dealt with. Is that kind of what it's looking for?
Yeah, so specifically in this research, we're looking at patients that have co-occurring conditions, complex conditions where we're calling it cardiometabolic condition plus a behavioral health condition. And so really what it's doing is, yes, trying to understand these complex patients as we look at them. What are the insights that can be derived in order to deliver those insights to the providers at the point of care in order to change that trajectory and provide them with better patient outcomes.
What about this that this AI is looking at and looking for? Is any of this currently jobs that humans do, or is this something that wasn't being done before?
Yeah, this represents a completely novel partnership. This idea of, again, and that's what the Aim Ahead project provides the opportunity to do, is to create this opportunity in a place, in a capacity that might, in a limited resource setting that we might not have been able to do otherwise. So again, this is not something somebody was currently doing. This is a novel approach for the Iowa Health Centers to partner with these expert partners nationally to develop an AI focused tool based on Iowa Community Health Center data.
Are you guys concerned at all when we talk about AI and healthcare and patients and data about, people have major concerns about privacy and about leaks. What do you say to combat that?
Yeah, so our process here has been really deliberate on prioritizing that privacy data security piece. Iowa Primary Care Association has followed all responsible, transparent practices as we built out this project. The data used and the processes used are all compliant with the HIPAA standards. The National Institutes of Health have their data standards. The Federal Institutional Review Board, their standards. So we've we've prioritized that piece in de-identifying the data and prioritizing data security in order to prevent such things from happening.
But we're going to stick with our healthcare news and turn back to our conversation about AI. Recently, the National Institute of Health awarded the Iowa Primary Care Association more than $500,000. We spoke with the PCA in our first half hour. Over the next year or two, that money will be used at clinics across Iowa to train a new AI model. And that includes community healthcare clinics in the Quad Cities, Clinton, and Muscatine. But what does that mean for you, your doctor, and your healthcare data? For that, we chatted with CHC's CEO, Tom Bowman. Take a look.
All right, Tom, thank you so much for your time today. We talked a little bit earlier about what this program looks like, but what does it mean for CHCs?
Yeah, so when you're thinking about at the clinic level, which is, what our organization is, we're always looking for new tools to be able to help our providers be super efficient in their care. Our patients are very complex, and so a lot of patients have multiple comorbidities, whether it's mental health challenges, behavioral health needs, couple that with chronic diseases, diabetes, hypertension, those types of things. And so when a primary care provider like at community health care is seeing those patients, they need better tools to be able to understand the full complexity of that patient. And so the NIH grant that was received by the Primary Care Association really will allow it'll allow the FQHCs in the state of Iowa to be able to use de-identified patient information so that the AI tools can look at the total complexity of that patient and be able to flag certain patients that might need additional diagnosis or additional treatment planning. Because everyday life of a clinic, they're very busy. Our docs are very busy, and they do a great job of managing patients' medical issues. But at the same time, it can be hard to see all the different challenges that patient might be facing. And we're hoping that these AI tools, when deployed and looking at databases and patient data, that they'll be able to help us shortcut, so to speak, be able to pull all that information together and help docs, give them tools to make better decisions.
What kind of connections are we talking about here? What would be an example of maybe a behavioral health factor that the AI would go, that might mean something?
Yeah, well, I think, oftentimes we talk about behavioral health and medical health as though they're completely different spheres, right? And more, what we try to do is integrate behavioral health and medical together, because a lot of times you might be suffering from a medical condition. Let's say you have heart failure or you have diabetes recently diagnosed. That can also affect your mental health, and you might start developing anxiety or depression around some of your comorbid conditions. And so we have to be able to identify patients that are at risk for developing other symptoms based on, a recent diagnosis or something that they have.
How might this have an impact specifically on rural clinics and rural patients?
In the rural areas, one of the things that this NIH grant is trying to do is it is focused on a different population. So a lot of times when they're doing AI projects or research projects, a lot of times that's based in your academic centers and some of those metro areas, that type of thing. In our case, the federally qualified health centers serve specifically a large amount of rural patients in Iowa, and also a lot of low-income populations. We are disproportionate amount of minority patients that we see, immigrants and refugees, all those types of things. So it gives a different patient set for the AI models to look at.
So right now, it's using patient information from community healthcare centers, from Quad City patients, but it's not giving those tips or those flags to the doctors just yet. That will be probably about a year from now, you're hoping?
Yeah, we're hoping. Yep.
Well, obviously, when we talk about patient data and AI in healthcare, a lot of concerns come up. I know you keep saying de-identified patient data, but what can you say to ease people's minds that are worried about this?
I think, doing data studies has been done for a long, long time. And so what you want to be very careful about is you don't want individual patients and their identifiable information. So you're thinking about their name, their address, things like that. So we don't look at that. We look at diagnoses, CPT code or coding, those types of things that would not relate directly to that patient. What it does is it kind of pulls all the patient data together versus individual patient data. And so we take that very seriously. And there are a lot of firewalls, for lack of a better term, in there to make sure that individual patients' information is not shared with the AI. All we want the AI tool to look at is groups of information so that no individual patient's health record can be understood and used for any other purpose than research.
Looking down the line into the future, as AI becomes more integrated, what sort of role do you see it playing at community healthcare?
It is one of the things we talk about all the time is we are trying to make it easier for docs to treat patients and easier for us to manage patients' health, especially as many of our patients are so complex in their needs. And so this is it's like a force multiplier. So whereas it used to be a doc would need to go through a paper chart and look at all the history and pull in all the information from all the outside providers and specialists and pharmacies and everything else. The AI tools are able to pull that information in much more efficiently and put that at the doctor's fingertips so that they can have the most pertinent information in front of them when they're seeing that patient. So it just really helps make the process more efficient and more accurate in most cases.